Hey everybody, it's Leah, and today we're going to be taking a closer look into my knee surgery incisions and all the little cuts they made. So yeah, let's get right into that. Also, I am in a different room because it has better lighting so you guys can see the knee, and also a lower chair so it'll be easier for me to film that. So let's get right into this. Alright everybody, so here we are. I got my knee out of the brace. It's right over there. It's a huge immobilizer, so it keeps my leg completely straight. But I took it out so you guys could get a better look at this. So as you can see, it's very much more swollen actually than my other knee. It's very, very prominent. These are my surgeon's initials, so they know which knee to operate on when they're in the operating room, but it's just marker, it'll come off. But yeah, you can obviously tell there's a ton of swelling and discoloration around over here. And yeah, so I'll get this one in a more comfortable position so I can properly record this. Alrighty, so here is my knee post-op day 4. So basically what they did was this incision right here and the one over here with the blue sutures that you can see are arthroscopic holes. So basically an arthroscopic surgery is they go in with a tiny camera, look around, and then they go in with more smaller tools that basically fit onto a pole that goes into my knee, and they can pull it out that way, and that's very, very minimally invasive, and only these little punch holes basically in my knee are the results of it. So that's what they did to get rid of the bone chips that were in the side of my knee. And if that was the only thing that we had done, then I definitely would be walking already and my recovery would have been so much faster. But obviously I didn't because there's this big boy. So basically this big incision, which you can't see because of the steri strips, which I'm not allowed to take off, they have to fall off on their own, is a 1-inch incision to tighten up the medial Patellofemoral ligament, MPFL for short, obviously. And that basically is the ligament that's responsible for stabilizing your kneecap. So I've had knee problems in this knee for ever, as long as I can remember. My kneecap is very prone to dislocation also. I'm sorry. I have to hold my leg up because it's very wobbly because I haven't been using it. So it's not really used to bearing weight or holding itself up. So yeah, let me just hold that. But basically the incision, they went in, they overlapped the ligament onto itself, so then it would be tighter and also hold my kneecap a little bit better than it was before, which would result in this huge incision. He couldn't go in arthroscopically to do that, obviously, because it required more of a personal touch, basically, so he had to go in there and mess around with it himself. The tools with the arthroscope would just not work with this kind of ligament reconstruction, basically. So yeah, if you guys want to look up different or more technical medical terms for the MPFL recovery and surgery procedure, then there's a ton on YouTube that I watched before my surgery. And yeah, overall pain level is basically a 1 sitting like this. Even with the brace off, it's fine. I just can't walk without the brace as of right now. My muscles just are not put together right now. They forgot how to be muscles essentially. So yeah, this is basically a look at my my surgery wound. Now everything, although it looks really dirty, it's actually very clean. The quote-unquote dirt that you see is actually dried blood, which is kind of gross, I know, but obviously that's what's going to happen when you get surgery. But yeah, everything else is looking pretty good. You can see some of the marker that he put to label where he wants to go in. Obviously he didn't go in. I have no idea what these are for. But you can definitely see the discoloration and the bruising still. It'll all go away in time. I should be fully recovered in 6 weeks, so that brings us back to the end of March, which is a very long time from now, it feels. But if March goes the same way that January and February did, then it will be over very, very quickly. So yeah, that is my knee surgery wound as a whole. I hope you guys enjoyed this video, and if you did, don't forget to comment, and subscribe. And just, yeah, stay updated with my knee surgery recovery, and I will see you guys in the next video. Bye.